Scott County, providing safe, healthy, and livable communities.
As Scott County delivers, we're going to receive information on the jail study update. So it's the main event, and Chris Harder is going to get us started.
Good morning, Madam Chair, Commissioners. We are very pleased this morning to give you the first update, first year of progress on the jail study that we presented to you last July 2022. You'll remember that there were three goals of that study: to reduce staff turnover and stabilize staffing in the jail, to improve our services to vulnerable residents, and to improve operations within the jail so they were efficient and effective. Overall, I think as you go through this report, you'll see that there's been a lot of progress made in a lot of areas over the last year. And in some, there has been less progress, and we're going to talk about that. I think that it's important to remember that this study was initiated by the jail leadership back in 2019. And they came forward to administration and asked for some assistance to improve workings in the jail and to address the staffing issue. Most of our work was interrupted by the pandemic, although the work that Paula Gustafson and the jail staff did on operations continued even through that time. So the study that was started in 2019 actually came to you in July of 2022. So just understand the time lapse there. So this is our first report out. It is important, I think, to remember that some of the recommendations really had to wait until we had stable staffing. And I say that to put things in context, but I also invite your comments or your questions on rate of change and rate of progress. Like, I still think that that's a conversation we want to have. Unlike other Scott Delivers, we're going to walk through this by recommendation. There are 8 recommendations. We're going to walk through that. Evan's teed up to pull up the relevant data for each of the recommendations. And so I certainly invite your comments and questions at any time, and you can go back or go forward or whatever, but we're going to try to walk through by recommendation. Okay, so with that, I'd like the facilitators to introduce themselves. Then we'll ask the panelists to introduce themselves and just explain, just in brief, what your role is in the jail and the jail study follow-up.
All right, Brad Davis, Director of Planning and Resource Management.
Danny Lenz, Office of Management and Budget.
Lisa Fries, Transportation Services Division, and also a member of the Jail Steering Committee.
Paula Gustafson, Business Relationship Manager in the Transformation Enterprise Service Division. I played a role of process mapping with the jail in 2019, 2020, 2021. We spent quite a bit of time together. And then also did some observations at jails in the metro for comparison and understanding where they were dealing with inefficiencies or efficiencies in their jails as well.
Amber Barnes, Supervisor on Adult Mental Health with HHS, and I specifically supervise coordinator response.
Molly Berner, Director of Community Corrections, and specific to this study around juvenile bookings and also around our reentry probation officer there. And over to you.
Caleb Madden, Scott County Sheriff's Office.
Scott Retke, Jail Administrator.
Luke Hennon, County Sheriff.
All right, thank you very much. Danny, you want to start us off?
Yeah, so the first recommendation was about really focused on the staff turnover, how we address that, looking at operations from that perspective. And there are a number of progress notes, obviously the large increase in staffing, but one of the more interesting things to me is the changes to the recruitment practices. How has the Sheriff's Office of the jail specifically looked at doing the recruitment process differently, which I know has garnered some success. So if you could just walk us through kind of what you're looking at differently there.
Yeah, Caleb, go ahead.
Absolutely. So in regards to our hiring process, we've made considerable changes throughout the process, both in our initial hiring, the actual process, we've shortened that quite a bit, as well as our ability to attract new candidates. So that's been really big for us. I think we found that as we've increased the amount that we can hire to, we seem to catch up to that number much quicker. So today we're looking at a much higher than we've ever had before. We have approximately 47 employees working for us. Where we struggle is in that sort of turnover and churn. we have trouble catching up to the amount of people that can actually be assigned to the floor. So of those 47, 34 of them can work on a shift today. And that's where we struggle.
What were some of those things that you did differently in terms of shortening the recruitment process and engaging more people and getting them to apply?
Absolutely. So we've done several things. I think one of the key things that we looked at was attracting a wider variety of candidates. So we established a new class of employee working with our employer relations folks. We made up a position that could be hired with different qualifications for the job. So we're attracting candidates that we've never attracted before, which has been huge. We also changed our advertising quite a bit. So we've moved much more towards social media, which has been big for us, and we've been attracting folks that are looking at a second career as opposed to, their first career. So that's been a big change for us. Besides that, I think our actual hiring process, the background has been shortened. We've taken a lot of those steps in-house. So we've taken our hiring process, which used to be 4 to 6 months, and we've reduced it down to 2 months, and without removing steps, but just by kind of trimming some of the excess as far as time is concerned.
So one of the things I know is that this has netted larger groups of employees coming in, but also could mean that more washout a little bit. Can you talk a little bit about the challenges associated with that and the kind of the turnover? And I know we have the turnover data here, and the terminations are still fairly high, but my sense is you guys are feeling better about what is remaining. So can you talk a little bit about how that turnover process works with this new kind of hiring model?
Certainly, when we have, we're hiring more people are leaving us as well. I think we've learned to cope with some of that change as far as our own internal processes. We start classes of officers together and move them through in sequential steps. It's taught us a lot. It's been very beneficial to us, but I also think the training itself and the work that we do is there's inherent turnover. A lot of people work in corrections and it's just not for them. So we're learning to deal with that, and then also change some of our internal processes to hopefully meet some of those needs. Sometimes it's really difficult for somebody coming from a career where they're working 9 to 5 Monday through Friday to step into a 24/7 operation, and you're working at 4 in the morning on Christmas morning, and that's difficult. So we've tried to establish some things that promote some fairness as far as people have to be here, but opening that up more to a wide variety of our staff.
And Danny, I think in the past, we maybe hired 2 people out of a whole hiring process. So maybe every 2-3 months, a hiring process happened. We ended up with 2 candidates coming through training. We probably didn't wash nearly as many, but now we're seeing groups of 9, 8, 7. And we end up with 4 or 5 people that end up getting through all the training. And so the numbers grow inherently through that. But also, I think we're probably more individualized when we do the training now, too. We send people off into their different phases, but we're very attuned to kind of what their needs are, or their skill set, or their learning style. So definitely seeing, I think, like you said, today we're at 47, 48. Prior to that, our number was 46, a year ago, or prior to a year ago, our number max was 46, and we were pricing at 32 on a day like today. So we've definitely moved that goalpost up a little bit.
On page 2, there's some very, I think, preliminary data about the number of bonuses, hiring bonuses that have been awarded so far. And I know that it's early. Do you anecdotally have any thoughts about how effective those bonuses have been?
I think what we would see is we used to experience prior to the bonuses, some people that were leaving, we'd get them through training, and maybe at 8 months, 7 months, they would already look for a new job, and we'd be like, well, we just got a month of work out of them, out of all that training.
Yes.
And now it feels like people are leaving more at a 2-year mark, or at a 1.5 years, or a 3-year mark. Just I think last week we had somebody resign at 6 years. Well, that's way better than 14 months.
Right.
So it seems like it's extending that and helping, but not a lot of data yet either.
Right, it's early. Okay.
How many of your new hires come from other agencies working in other jails, and then they come to Scott County?
I don't have specific numbers with me, but it's a fair portion. We've hired a considerable amount of people, especially from out of state. We found, I think, our online social media advertising to be really effective in attracting candidates from Los Angeles County Sheriff's Office. We've had people from Texas, Oklahoma, but these are experienced correctional professionals that are coming. They just want to change, or they want a different place to live with their family, and you know, we can certainly provide a much colder environment than Texas. So,
And is there training experiences? Or are you often training them how to do things differently than what they were used to in another setting?
absolutely, that's a challenge for us, and actually more for them. We certainly, I think the joke is always, is it better to have somebody who knows nothing and comes in, or knows enough to be dangerous? But no, overall, that's a huge benefit for us. They're bringing experience and knowledge that we don't have, and sharing that with our staff and our training folks. So it's been great.
Yeah, our first online ad, accidentally, we made it nationwide as we were learning how to do these. And ended up finding someone from LA County who was like, no, we're looking to move to the Midwest to raise our family. So now we do a portion of our ad for a few days, at least nationwide, and then we condense it to more of the Midwest or Minnesota, Iowa. But we generally do, Missouri, we find people that are looking to come to the Midwest and see our wages and our benefits, and it's attractive. So it's been an interesting journey on that part.
One of the phrases during our time with the jail study, as we were looking at staffing, was net annual work hours. And is there anything you want to say about that will help just like a person reading this document to just understand the staffing piece? Or maybe it's not relevant to this conversation today.
Well, I think net annual work hours certainly apply as far as the training hours, right? I mean, it takes roughly 90 days to get a new corrections officer trained in where they can actually assist us with helping fill in shifts. And so applying those hours, and when you're hiring bigger classes, again, you need the field training officers that can train those staff, and it is a big operation to train people, and those people need breaks. Those trainers need breaks, and so then they need time off and time away to sort of collect their thoughts. And so it is impactful for us. So hopefully, it definitely feels like we're trending in the right direction, though.
And prior to adding these new staff last year, that's when we really felt the pain. We had times where 3 people were on a military leave for 9 months to 12 months. We would have, well, even this year, we already had 2 babies born in the first 2 weeks of the month, of the year. So all those folks being on time off, PTO, medical things come up, light duty issues come up, where they're off the floor, and having that additional staff, we're able to run the building still with and absorb that way easier than we did in the past.
Okay.
Absolutely.
Can you talk a little about how the shift to the 8-hour workday has been helping with morale of staff and other challenges that may present to you as administering staff, scheduling and stuff?
I know that, so currently the corrections officers are on 8-hour shifts, and there's been a lot of conversation about 8 and 12-hour shifts throughout, over years, I would say. And I think that, we've discussed this with the sheriff. We've had conversations around what would be the most efficient, but we've also went back to the COs themselves and asked them what they want to do. And
it's based on their current contracting,
correct,
bargaining contract.
Yep, and the current contract allows for 8s, and so this is what they want to do. We're confident that the schedule we built is what they want, and so I know that they appreciate having some input and the ability to participate in when they're gonna, what kind of shift hours they're gonna work. So it's been it's kind of required us to consistently communicate with them about, if we do this, then it looks like this, and if we do that, it looks like that, and this is where they want to be right now. And I think we feel confident that it'll be like this throughout. Up to them if they want to renegotiate that and look at 12 hours again.
Oh, go ahead, Danny.
And following up on that, when we were interviewing your sergeants and things, after the 12-hour shifts with mandatory overtime, the next thing that came up was doing med passes as their biggest kind of frustration. So one of the recommendations here was the 4 medical technicians. How is that going? Have you heard anything from the corrections officers about not having to do medical passes and that sort of thing?
Yes. So we know that part of the job it has become so much more complex over the years, and I think we currently, as of today, we have 2 of the 4 positions filled for medical assistants. I do believe that the COs appreciate having that task taken away from them. The challenge for us right now, of course, is that we're kind of in this gray area where they still do have to have the skills and the training to do it, because again, we only have 2 of those 4 positions filled. We have 2 of our 3 nurse positions filled, so we are still working towards getting them up to doing that task. And I mean, I think the comments I hear about it are, we want it, but we don't want to have to either do it or not do it. And that's a challenge for us right now. We're going to struggle with that until we get those positions filled.
It was interesting, the reference to the workforce mobility program that Health and Human Services has just launched. I'm wondering if you can just talk a little bit. I know those conversations are preliminary, but just what do you see as possibilities there?
Sure. Met with those folks. Our business partner from ER, Joan, and I met and had a conversation. I think right now we met with the person. I think it's Dakota County Tech is who they're from, and we met with them. Right now, we're having conversations about specifically the training that they offer, and learning about the healthcare field has been quite an education for me about the different certifications and requirements around that, and then just finding if that's going to meet our needs. And it looks like there may be something that could work there. So we're excited about that possibility moving forward.
Before we move off the staffing considerations piece, Evan, can we go to page 14? You included a number of data slides that demonstrate what the population looks like in the jail and some of the changes that certainly influences the experiences of your staff, and tells us, I think, something about how we're using the jail overall. And so on page 14, you have average daily jail population, then that's broken down further in the next couple of pages. I think one of the things that I thought was interesting is actually on page 16, where it starts to break down by offense type. And I'm wondering if you can talk a little bit about that and what this data says to you about, on page 16 and page 17, about what that says to you about how we're using the jail.
But I'll start with just page 14, when you see those numbers, so of course COVID and the shutdown of the courts and all those things, the number was really low, but we assumed that once the courts got running again, that number would come back to normal and then grow as well, because the backlogs and all the changes going on in the world and crime trends, and things that people are reading about. And really we came up and topped off and dropped back down, and now we see an average right around 100 or a low 100, which to me speaks to, in the role of the sheriff, I have really little control of what that population is. The arrests that happen in the street or the events that happen in court are what drives the people that are coming, people that are staying, or how long they stay. So the efficiencies in the courts are the biggest driver of that I see, of not seeing people come in and have to wait multiple months to have different court hearings or sentencing or things like that really drive that number to be always growing. So to start off, that's kind of the biggest piece we see, is it's normalized now that 100 is that number, where prior to COVID we were at 130, something was growing probably 2 to 3 a year. So then jumping into the population, we did a lot of work through Justice Steering and different committees prior to even my tenure of trying to look at who's in the jail and why they're staying, and then those numbers play out now, is what we see, is the amount of misdemeanors, and lower level offenses have really declined, and we're holding people that we should be in jail, that we should be afraid of, and that are a risk to our community. And people that are coming through on other stuff are getting dealt with through the courts and moving through the system very quickly.
Luke, the question I had on page 14, and you mentioned kind of the stabilization at 100. I just wonder, and kind of the trend since COVID, I wonder how that compares to other metro counties. Are all metro counties experiencing that, or some different than others?
No, actually, I would say a lot of metro counties are seeing a return to their pre-pandemic population numbers. Again, I wish I could, as Sheriff, I don't know that there's a lot of data for us to understand why that is. I think, the courts in Scott County have done a fantastic job getting through their backlog of cases maybe in a manner that some of the other metro counties didn't have that luxury. I know we've certainly benefited from that, but I do think that we're a little bit of an outsider there in that question.
And I think one easy data point would be the PSI work that's done, in Molly, and prior to that, even prior to the pandemic, we knew that was an issue, a staffing issue, to keep people moving through. So you'd get convicted in court, but then sit for multiple months before we could get you in front of a judge to get you sentenced because of the process in there. And Molly, what's the timeframes now of those, PSIs being processed versus what it was prior?
Yeah, so out of custody, it was, when I started, it was around 12 to 16 weeks, and now we're down to 8 to 10. And then in custody, we were probably more of like that 8-week mark, and now we're trying to get them done within 4. So we're trying to not quite half that. In custody we are, and we're able to do that now based on multiple different things, including getting more staffing as well. So.
One of the questions that came up as we were planning for this conversation today was about borders, and you talked about some of the improvement, but still some challenge around staffing. And so page 18 shows the number of a monthly average of boarders coming into the jail. Can you talk about how that makes sense and how you make decisions about taking or not taking boarders?
I'll start it off and let Caleb and Scott fill in. A lot of it is based on supply and demand by other jails. So there's a lot of resource sharing that happens amongst the state, amongst county sheriffs. So whether we have a drowning on the Minnesota River and we only have a handful of boats to put out there, a county like Hennepin County or Ramsey are going to send down half dozen people to help us for multiple time. Or if we had a major incident like that, they would come help us, we help them. So what we ran into is we had some counties that really needed help this summer, Ramsey County specifically on their boarding. Then we ramp up our ability since we could, and our staffing level had stabilized by this spring that we could actually feel good taking on people without adding more pain to the staff, being like, wait, now I got 20 more people to watch or whatever. But so we help them out. You see that number dropped off now as their licensing issues are corrected and they're not have that need. But definitely a lot for us was, do we have enough staff that we're not going to add more burden on them by saying, oh, in addition to mandatory overtime and all stuff, we're going to look like we're trying to make money, at the same time. So a lot of it is that, but a lot of it is what's going on around the state or the metro as well, of what the needs are, helping each other out. In the past, there was remodeling projects at Anoka County, 16 or 17, so we took on 40 inmates for a few months while they did a whole remodel, so a lot of it is that. And then some is just the natural work release. Department of Corrections, there's some ongoing contracts where they'll place somebody in our county because it's a appropriate spot for their work release and things. So we'll have some numbers there.
Yeah, no, I think you explained it really well, Sheriff. When I think of borders, I think of 3 things, and that is, 1, what is our current population? Where are we at? What can the jail manage at the time? What is our staffing levels? And we want to be sensitive to that, especially with some of the challenges we've had there. And then when I think about it, it's what do we have going on in the jail? Whether that's some special project or unique thing we have going on, whether, we had our floors done or we had safety barriers built in the facility and that shut some things down. And so we kind of, I guess, get together as a team and kind of discuss what we think we can do. And usually it's another county reaching out to us. So it's well known at this point that we could accept someone if somebody wanted to ask, especially maybe with our female population more so than anything else. But we certainly want to factor those things in. So
And a lot of that isn't the total number of the jail population too, it'd be what they're sending us. Like I said, if it's a female inmate and we go, okay, we can house 60 and we only have 15, we have a lot of room. That doesn't change our staffing needs or needs there. Or for men, it might be pretrial that we would look at that housing and go, what can we absorb in there? But it doesn't involve like adding more people on shift or changing the jail processes. It's more of what can you fit in those buckets.
Let's move on to two of the recommendations in the jail study really merged together and probably should have been better written by the person who finalized that report. But really what it does is it looks at developing a case management model and using some social work time, using our reentry resources differently, and trying to build some more effective, efficient ways to move people through the initial intakes and data collection, and then to help them while they're in the jail move on to whatever they need to be successful when they leave. And so it's a lot in these two recommendations. One of the things we have heard about already as part of our coordinated entry discussions is the work of the embedded social worker in the jail. And so Amber, the data on this screen looks at the number of inmates that have seen the jail social worker. I wonder if you can just talk a little bit about, from the HHS perspective, like how that's gone and what you see as some of the big wins from that.
Yeah, I mean, I think, so Katie Pearson's our jail social worker. She initially started in the jail in March of this year as a full-time jail social worker. And I think since March to the end of December, she saw like 416 inmates, which is just flabbergasting, to be honest. And I think the reason Katie has been so successful is partly because she's amazing at her job, but the other piece is word of mouth around the inmates. I think, she has incredible follow through of actually helping get people connected to services. An inmate will tell another inmate about that success. And then everyone's wanting to meet with Katie for support. So I think it's been incredible to have her there full time, and we would love to have, 2 jail social workers if we could. So.
Okay.
So one of the interesting parts about this is when we're looking at the process stuff, and maybe Paula, you can talk to this, or anyone really is, that there were like 5 or 6 screenings an inmate had to go through by the time they got booked into the jail to sometimes even before they had their first appearance before a judge. Can you talk about what you've looked at for some process improvements in that area to help reduce the number of screenings, especially when it's being conducted by 3 or 4 different individuals?
Yeah, we actually have spent some time with some of the staff at the jail to go through some of the mental health screenings. There's physical health screenings, there's mental health screenings. They happen at intake, even when the person is sitting in a car, and then when they're coming in through booking, and then when the nurse comes back through. So there actually has been some conversation with several staff members as well as a sergeant to look at where are we going to optimize the screenings. Some of it is currently the system that we have, LETG, and so we would need to actually change some of those screenings. So we are just, we've basically done is we've gathered all the different data points, looked at where are we crossing over and asking these data points multiple times, which not only annoys staff members, but definitely annoys the person being booked in. So we try to get through that. And then also talk about which ones are important at what phase. Why are we asking this question here when it's not really imperative to getting them into the jail, but we want to make sure that the nurse follows up and asks that question within 24 or 48 hours. So we've been trying to allocate different questions to different areas. So we're prepping ourselves for the future to try to streamline that. We've talked about moving some of the screenings that we do at the beginning back to the nurse because it's not important, and then moving some of those other more critical questions like suicide, ideation, other mental health questions, but making sure those are getting asked very early in the process. So I expect we're setting ourselves up for current success, but then we're certainly setting ourselves up for success when we're able to get a new JMS system in there and really start working on those screenings. Anything else you guys want to add to it?
One observation I would only make about the screenings is I think sometimes some of our questions that came out of it was it needs to be certain people that do the screening, right? It can't always be the booking officer or the intake officer doing that screening. And so, you know, health assessments need to be done by the RN, as an example. They shouldn't be done by a corrections officer. So I know that's one thing that came out of, I think, when we discussed maybe having the reentry person do the bail reviews, and how we think that should be a community corrections person doing it. And so those challenges, we would like to, of course, have that one-stop shop for all that stuff, but.
Well, a new perk is a new EHR system that they implemented in 2021, 2022, and so we are actually able to have a little bit more flexibility with the EHR system and get some of those more personal psychological and medical questions into that system versus the JMS. So we've been able to at least leverage that to some degree as well. And we're still adopting that system, but they've done a lot of work on making sure that that system is being leveraged to its capability. So.
And I think similar to what we talked about, Katie, the social worker having connections with people, the nurses, people not in uniform are going to get better cooperation or more accurate answers on some of those things that are real specific or sensitive. And then another piece we run into too is some people coming into our facility are impaired or intoxicated to a point that we don't want to ask too many of those questions up front if we're not going to get an accurate answer either. And so it's balancing all that out is what we're trying to do.
There have been some stop and starts with the reentry person and that position, and just how we're going to dovetail the social worker and the reentry person so that we're not duplicating effort. And Molly, I'm wondering if you can talk a little bit about just the stops and starts and kind of what the current vision is. As I think it said you had a new staff person coming soon, January.
We do, yeah.
Yeah.
Happy to. So I started in 2019. This program with reentry was not too far before I started, and there have been a lot of starts and stops, and they've been for a variety of different reasons. Some of it is the hiring and retention, just plain and simple. And so then, of course, COVID and what that did to our ability to do some of the stuff in the jail and who was going to the jail and all those sorts of things. But we still, with process mapping and in collaboration with this entire team at the table, I also understood that I think that because it was a 0.5 position, it's always been a 0.5, and what is the other 0.5 of that position alongside somebody that's really meant to be, inside the jail, and how often is that other 0.5 pulling somebody away, or those two things really, being almost like a push and pull, and then those types of functions to their job, like what ends up getting kind of trumped, for lack of a better word. And so moving forward, we're happy to say that Alexis Nasty, who's a current employee here, will start next Monday with a group of other probation officers starting. And we restructured based on the fact that we were getting more positions to have this person be also meant to be embedded into the jail. So now it's a 1.0 that we'll be working with in the jail, and they will do all of our bail evaluations with inmates at the jail. So that will be the other 0.5 of their job, along with the reentry services. The other piece and vision to what we hope going forward, I think really nicely discussed along the panel was how important the roles of the individuals and what they're trying to achieve, whether you're uniformed, whether it's at booking, whether you're a social worker, a nurse, et cetera, right? And so I think the idea with probation is we have involuntary clients as well. So where you might see Katie work with voluntary clients, people that are seeking that out. Oftentimes I may have clients that aren't falling into that category. So the other vision with this is that we have somebody embedded in the jail that's going to proactively reach out to all of those involved in corrections, Scott County or other counties, to help with coordination, whether maybe it's another probation officer in another county, maybe it's within Scott County, or it could be nationally too, quite honestly, right? We have people that come in. So how can we help the client, the inmate, and the system be able to help that person better navigate so that their reentry is also as successful as possible? And so having somebody that's dedicated to all of that within the jail, we are hopeful that this, both a new structure and then we're in a different space with the hiring and retention, that this, we're really excited. Worked on that panel with Caleb specifically, but in hiring this person. And so look forward to what that looks like.
Okay.
All right. So one of the areas that over the years I've had discussions with is upon release from the jail is getting people to where they need to go. Maybe I know that you started using Lyft in 22, And it looks fairly cost-effective when you compare it to transit service. Can you talk about the benefits of having that direct ride home versus some of the other methods that we've used over the years for folks being released from jail?
Yeah, so we've gone through several stages of this where, you know, ultimately someone gets arrested, they're in jail, they get released from the jail and they have to get home. We have a lot of folks that don't live in Shakopee and certainly not in Scott County. And our transport links, our first iteration was to look at bus passes and getting people on a bus and hook them up for services to get them back home. If they don't live in Scott County, some of those links are just, they can be confusing, they can be difficult. So people weren't getting home or they weren't getting on the bus. So we had people sleeping in the jail lobby, and that's just not the place. Or they'd go down the street and go to the library or to another business in Shakopee, and that became a problem. So we started using Lyft, and it's been great. So most folks don't need this service, but those that do need a ride home, when we're able to set them up from a ride directly from where they're at to where they need to go, has been really beneficial. And I agree. I think it is a cost-effective way to get somebody to where they need to be and not staying in the community. A lot of people have their own issues going on, and if they end up staying here and getting arrested at the gas station when they just got released from jail, that's not a benefit to anybody.
Just anecdotally, I mean, that we haven't seen happen now, knock on wood, in many months, since that used to be a common occurrence each year, is somebody would come back within 20 minutes or an hour of getting released by committing a new crime, something in the community, and generally observing that crime was they're stealing a car to drive home or stealing a bike or causing problems in the community. And even it's worked out people with medical conditions that are in the jail that the courts release them, and the Lyft is a good way to get them home so they can get back to their medical needs and things like that, versus also wondering how they're going to get there and navigate that. And I think an assumption gets made too that a lot of people are going north, right, which is generally, but there are some people that are going to New Ulm, going to Mankato, that our buses don't have many options specifically going those directions either to get outstate. So it's been an easy win to make the correction there and get it done.
Yeah, I think this weekend, even obviously with the weather, became really important. I think there were 3 or 4 rides that we offered up this weekend. So really great service that we've offered. And I think the staff know to, if somebody's getting released during business hours, we still have other options that maybe we can ask them to use. But in the end, it's a great tool. Certainly appreciated.
All right. Recommendation 4 talks about stabilizing medical services and resources in the jail, and there's some data related to that begins on page 19, and there's a series of slides after that. But I'm wondering if somebody could just speak a little bit to after the jail study was reviewed with the board. There was an increase in physicians' time. There was the addition of the medical techs that Danny referenced earlier. And then your narrative talks about a need for a nursing supervisor. Can you talk about how all that, what's the current state of that?
Sure. So the current, again, just to reiterate, so we're able to hire 4 medical assistants. We have 2 of those 4 positions filled. Right now, we're able to hire 3 RNs. One of those is a lead, though we were just recently approved to move one of our nursing positions into a formal supervisor. And so that position is currently open right now. And so we're excited about that opportunity. So we have 2 of the 3 nurse positions filled. We do have 1 other candidate who's going to be starting with us later this year, March, I can't remember, April. So that's just a point in time where we're at today. Some of these statistics that you're seeing here, I think they do show, they do tell a story. We have been short on some of our nursing numbers, and so I think as a consequence to that, you may see that sort of our physician numbers, people that were pushed to see the doctor because they couldn't get to see the nurse. You'll see some of that. I also think you can see we've more or less, it tells a story on emergency room services, how often we're using the emergency room. The emergency room in the jail can be used for a variety of different reasons. Some of those come out of clinic, so the doctor themselves maybe send somebody to the emergency room. But then, of course, there's incidents that happen in the facility for a variety of different reasons as somebody gets sent to the ER. The goal, of course, is to triage people, and so they see the services that they need. We do, the nurses, though, get spread thin. So the plan, of course, is to get the medical technicians, when they're not passing meds, to assist the nurses with some of their administrative work so that we can get the nurses seeing people at sick call and meeting with the inmates and doing that patient care piece. The nurse supervisor position then is there to be that quality control component to the entirety of the medical system. And so we're really looking forward to that. And I think we have some good ideas and plans for how to implement that as soon as we can get that position filled.
So are you in better shape today than you were a year ago?
Yes, I do think we're in better shape than we are a year ago. I think our planning is better for how we want to get the positions filled. Straight up staffing numbers, I think, are probably the difficult time was this past summer was when we were struggling staffing wise. We didn't have medical technician spots filled, and we were down to one nurse, and that created some real challenges for us.
I think as Scott mentioned about the medical assistants doing those other roles beyond MedPass, if you think of too, the average inmate is an 8 to 10 day visit. So that means a lot of people are there for a couple days, some people are there for a year. So all those phone calls to get medical records, to get prescriptions, people that are coming in that already have medical needs, there's just a lot of behind the scenes that when you don't have those medical assistants, now a nurse is making all those phone calls too. So there's just a lot of behind the scenes that happens to get everything up to speed on a new individual to make sure everything's working out for them.
What have been the challenges in trying to hire these positions? You've been working at it. Is it just lack of candidates? Is it lack of qualifications of the pool that are applying for them?
Yeah, so I think the first thing was for us to actually get educated around what our needs are, learning the certifications out in the healthcare field, figuring those out, working with employee relations to create a job that I don't know that the county had a great model for us to follow yet. That's the medical assistant job, I think, was somewhat unique throughout the county even. We know even from our peer counties that they didn't have a lot of experience with this. A lot of them have privatized healthcare in their facilities. So that was part of it, learning that. Then it was, I think the healthcare field has got its own struggles with hiring and sort of getting educated on that piece. What areas to advertise certainly are not the same as the corrections field, getting the word of mouth out. I do think it's gotten better, and I do think some of the opportunities that Chris brought up earlier around working with Dakota County on what their program may be, that could certainly be something that assists us. But yeah, unfortunately, it's just taken us longer than we'd hoped.
That was a question I had, whether we could share that position with some of our neighboring counties like Carver, Dakota, just to have a person that can go to several different jails.
Yeah, I think certainly with, I think each individual jail, manages their health care their own way. The model we have that we've operated for years is probably somewhat unique, certainly in the area. I do think Carver County now is following that. I think our medical director, Dr. Wilcox, works closely now with Carver. So there could be some possibility for us to think about things, certainly working with them. but most of certainly the bigger counties, the Hennepins and Dakotas, they've kind of got their own system in place, I think, right now.
Then back to the records management side of it too. Each community or each county is going to have their different medical record database, their jail records, that somebody walking in for that shift wouldn't be able to engage that stuff either. There's some complications there as well.
Under the physician part, shows that you have additional hours from Dr. Wilcox as well as Dr. Kennedy, which I know are at a premium. Can you talk about the impact of those additional hours as well as some of the process changes in kind of those doctor visits that I know have kind of happened?
Sure. So Dr. Wilcox hours now are runs his clinic twice a week, and Dr. Kennedy does the same. We were extremely excited to know that Dr. Kennedy was going to be providing more hours, and those more hours in the facility, and those hours quickly filled up. Operationally, it just, when, especially for Dr. Kennedy, what it allows for is it allows for more immediate follow-up. A lot of the concerns we have around our population and the mental health issues is them prioritizing when they can see the doctor. And so him having more time in the facility allows that follow-up to happen rather than him just seeing somebody new for the first time. And yeah, we thank you to Dr. Raditz and all the work that the Mental Health Center does in this county. It's been phenomenal. And yeah, I don't know yet that we would say the jail could probably use more hours, right? I don't know that we've capped off and sort of we still have an unmet need portion. Certainly with Dr. Wilcox, it's probably closer, but yeah, with Dr. Kennedy, the increase in hours has been absolutely wonderful. And you see that, I mean, all that stuff bleeds into the operation, right? So when a person gets on their medication and, we can manage them better in the facility. So it snowballs, that's for sure.
Can we look at that for just a second? Evan, can you go to page 27? So we talked earlier in this conversation about the number of people in our jail going down, and we look at the number of mental health assessments in our jail going up. And and one of the recommendations from the jail study was around some training and technical assistance to your staff. Part of it is what can external resources bring in? Is that adequate? But also, what does your staff have for adequacy of training, which wasn't possible when there was the staff churn. So I wonder if you can talk about that, about your internal capacity as well.
Sure. So when we look at our mental health, those are our crisis visits. So a lot of people that are in serious need maybe want to hurt themselves or end their lives, and we get somebody in here right away to address that. Some of the extended hours that Dr. Kennedy has provided have, at least anecdotally, has been very beneficial to our ability to manage those folks. When we looked at our average daily population previously, that number doesn't often speak to some of the other numbers that we're looking at here now. The population that we have are here for generally felony crimes, crimes of violence frequently, and then have much more significant mental health problems. The ability to provide services to those people is huge. So as far as the training that our staff currently goes through, you're absolutely right. When we were understaffed, when we just were barely had enough people to come in and work the shift, we struggled with training people and some of those specialty things that they need. Now that we're at a number that we're able to do that, we're much more effective in being able to offer CIT or some of the other trainings that come along with dealing with mental health problems. We've offered specialty training, specifically as it relates to suicide, health and welfare checks as they relate to mental health crisis. We've worked in collaboration with the Mental Health Center here, who's been extremely helpful, both in providing crisis visits as well as offering staff to come out and speak with our staff during their in-service training. So it's been really beneficial.
Nice.
So one of the observations I have about this data on this page and the mental health situation is that it seems to accelerate during COVID. And what kind of role do you think COVID played with some of the mental health challenges that you're dealing with in the jail population? And do you see signs of it shifting going forward?
I guess I don't, that's a good question. I don't know that I have thought about it from the perspective of has COVID impacted these kind of numbers? I think when I think of it, I just go back to, I guess what we discussed, and that is that there's still that unmet need in the facility around mental health services in the jail overall. And how, is this number more reflective? The fact that we, if we would have had Dr. Kennedy or some of the other services that we had today, 5 years ago or longer, would we still have seen these numbers that we're seeing today? I guess that would be my focus. But I guess I never thought of it from the perspective of COVID. Certainly something we can look into. I can speak to the medical staff about.
Yeah, I think I could probably just add from a mental health perspective that probably nationally we saw a major uptick in mental health crisis situations. And I think it's directly related to COVID. People were forced to isolate. They were unable to see providers for months, potentially years. They had limited access to medications. And again, I think that just has a direct impact. Even thinking like personally, being forced to isolate for 2 weeks when you had COVID, at the initial beginning of it that's a long time to not have interactions with other humans. And so I think, that has a direct impact on the mental health crisis that we're seeing right now. I will say, I think it's slightly improving. I think mental health as a whole has the stigma around it has improved, but our providers haven't been able to meet that. We just don't have the number of providers to be able to meet the need. So I think, our mental health center has done an incredible job of trying to prioritize crisis situations and people in immediate need. But we just still struggle, not even just Scott County, but probably statewide, with having enough providers to meet the need.
But I would say going and visiting the other jails, this clearly was not just a Scott County issue. Every jail that we visited when we were doing observations said their biggest issue and crisis was mental health and trying to get those needs met. So I think we're coming a long way here trying to address that.
Okay. One of the areas where we haven't been able to do as much work is on recommendation 6, which is building some kind of alternative to booking juveniles in the jail. At the time of the jail study, we noted that it was creating a work stoppage issue because of the legal requirements around having juveniles in the facility. And so I'm wondering, can someone talk a little bit about that, about the state of that? And we do have a previous slide. Thank you, Evan.
So I guess I can start. Sure. So and I'll just say, juveniles coming into the adult jail is a major impact on the overall operation. And so the DOC is very specific around the rules and requirements when juveniles come into the adult jail, regardless of the reason. Sight and sound separation from the rest of the adult population. And so it in essence shuts down the intake area of the jail, which again is the busiest and most, certainly the most volatile area of the facility. And so we're not allowed to, we can't process in and process out our adult population while we're taking care of that with a juvenile. And then the other issue around that is then finding that initial placement for the child once they've been processed into the facility. We have very strict limitations on that. We have a 6-hour requirement to get somebody in and out of the facility. And so we're very hopeful that our partners are able to accept the child once we can, and unfortunately sometimes they can't. In which case, you see some of the numbers. Am I looking at, well, that just shows, we are required to report to the Department of Corrections when we can't move a child out of our facility. So I know, you know, from our perspective, getting kids out of the jail, I think we're all in agreement with that, would be where we'd like to get to. But right now, yeah, that's kind of a summary of where we're at.
When I see this data, it looks like things were increasing from 2010 to 2019, and then something happened in 2019. Other than COVID, was there other practices or laws that came into effect that really changed that admittance?
There was nothing noticeable on the jail side, other than we're certainly appreciative of those numbers taking a dip like that, and the county overall has done a good job of trending the right way with less and less people. But I can't speak specifically if there were changes around requirements around arrests or how the state looked at.
I can't speak specifically. I was kind of looking over at maybe Ron here on the specifics on laws. But what I can say is that from a community corrections standpoint, even starting as far back as, in the 2000s and going forward, we've really looked at alternatives to placement of kids, just as a general theme. So I think that this carries forward. It takes a lot of years sometimes to shift like culture and practices and create spaces, which we're still struggling with in some of this data on the right places for kids to be, and do we have enough of those alternatives to secure detention, to non-secure detention, right? We want kids as a fundamental idea to be in the least restrictive setting possible, right? And so I think that plays into recommendations then made to court, as an example, on where kids are brought in. We have seen less kids being arrested, just as you see here, coming into the jail or in general. And so our juvenile population on probation is also very low comparatively to the other years. And so kind of overall, not just in arrests and admittance into jail, we're seeing that trajectory moving down. So that's good news. Yeah.
All right, the last piece I wanted to cover, there's a number of data slides that relate to the jail's reports to the DOC. And I wanted to start on page 25. And this looks at the number of special incident reports by year. And what I'm interested in, there was a reference in the narrative to a special incident review. And so I'm wondering, first, if you can just talk about, what is this increase, the upward trend in the number of reports for special incidents? And then can you talk about what you hope to do through this administrative review of special incidents?
Okay. So you see an upward trend in us, and so these, so everyone is aware, so these are incidents that happen in the facility that DOC places on us that we are required to report back to them. And so they give us a list of, and some of them are probably obvious things, if there was a death in custody or some other major incident, but it also could involve two inmates fighting, and one of them ends up having to go to the hospital to get looked at as a result of something. And so we take these requirements, and then we have to report them back, and then the DOC will review that, and then they'll follow up with Caleb or I if they have questions. So you can see we're trending up in the number of incidents that we're reporting back to the DOC, and then as part of that, in addition to that, Chris highlighted this idea of reviewing those, and so we've recently instituted a new process where we're going to be taking incidents that happen in the jail, and then administratively, myself, Caleb, and some others from our team will sit down and go through those to make sure that we are crossing our T's and dotting our I's and looking at those from a quality control perspective to see that we didn't miss anything. This is also our opportunity to review things that happened in the facility, say if there's jail video, we'll certainly take a look at that. We are still newly into the process of getting body worn cameras up and going in the jail, and so that'll be part of that. And so right now we're still working through what that process will look like. We've met, we've reviewed incidents, but I would certainly see that the number of reports that will be going to the DOC will continue to probably increase as we define better and better what we need to be reporting back to them.
When you look at this, would you say that the change in the trend is because we're having more incidents in the jail because of increase in pervasive mental health, that sort of thing, or we're doing a better job of reporting where we think we should, or maybe even a little bit more so?
Yeah, I would think we're potentially even over-reporting now. So in 2021, when Caleb and Scott moved to their positions, they have a different view on this, and even around the state, looking at jail medical issues and things that have happened, looking at how that definition, the Department of Corrections, looks at some of those things as, instead of trying to thread the needle and figure out what to report or not, they move to just, let's report everything that seems like it would be close, and just look at it in a different way.
Yeah, I think our inspector's been appreciative of that. I think we're getting good feedback from the DOC that if you're not sure whether you should or shouldn't, just go ahead and do it.
The last two DOC inspection pieces of data are the last two slides in the packet, so page 31 and 32. And there's some terminology. There's mandatory versus essential, which maybe could use a clarifier. But also just like if you could take, like what are the key messages that people should grab from page 31 or page 32?
Yeah. So I certainly think from these pages, I would certainly say that the jail has done well on its inspections over the years. I think the feedback we get from our inspector has, on the most part, been positive. The DOC requires the jails to be inspected. Typically, that is done on a biannual basis by the DOC, unless they have concerns, and they will do an annual. And so you can see, and this is just a representation of the last, I guess now it's 14 years, we've had back-to-back inspections done in 18 and 19, but beyond that, we have been on biannual inspection, which is, again, a sort of a simple way to look at how well or not the jail is done on its inspection or not. Some of those questions from 18 and 19, I think, there were some feedback we got when we got a new jail inspector and some other sort of steps we had to take internally to meet her requirements around our inspection. But so for the most part, we are doing. I've been pleased with our inspection reports. The sheriff, I think beyond some, and again, that's more highlighted on the next page, more around some of the concerns we would have around what those compliance violations are around. You can see on page 32 there, most of the, I guess all the metro counties had some type of concern around health and welfare checks. So I just don't want to make us out to be some type of anomaly with our peer counties. So it just, it has been I think a successful inspection last year. We have a self-audit this year, and we'll start preparing for her to come back into the facility.
And a couple pieces that have changed over the time I've been in as well is, like Scott mentions, we'd get different inspectors over time, and all of a sudden it would almost feel like a little different lens on certain topics. So you're trying to navigate that and figure out how they look at certain things. The rules, Department of Correctional rules, are looking at doing some revisions. For the last couple of years, there's been talk of rewriting some of the rules, which we would be happy to see because there'd be some clarity. There's a lot of, I don't want to say vagueness, but there's not a lot of detail in what's required in certain pieces. So now the inspector can have a lot of their own value and what they think that is or not. And then especially like even the last page, so we highlighted what our pieces were. That doesn't mean these other counties didn't have other pieces, so the graph kind of looks skewed, like we had more problems than others. Just we didn't highlight stuff that we didn't have a problem and they had a problem, but just trying to show that the welfare, health and welfare checks have been a consistent issue across the state of what is the definition, but there's this feeling at state level of they started to look at some definitions that the new rules might encompass, but aren't actually written in the rules yet. So there's some confusion there that has caused some consternation from sheriffs around the state. But we're hopeful that the state will look at revising those and making it more clear of what the expectations are. On a positive note, they brought in a new person into their structure we met with 2 weeks ago, but they've created an inspector general over the Department of Corrections that looks at multiple areas, but one is the inspection unit to kind of streamline. And what we've always asked for is consistency, like having the staff writing these reports have consistent terminology, thoughts, and just be more objective in how it is, so everybody knows what's expected and we can perform to that level. And he was very responsive to that. And we brought him some stuff of how some things get written where it says dangerous materials, but in the wording it talks about in our kitchen, which there's no inmates in. One of the rules says you have to have the knives and different things all accounted for. Yes, but there's no inmates in that area. So some of it is just the rules when they're written probably didn't even have counties that had contract kitchen employees or stuff, because they're so old. So we're hopeful that those new rule revisions will come through in the future here and really just level the playing field so everybody knows what the expectations are and they're very consistent and meet them.
All right. Anyone last question from the facilitators? All right. I think then I will ask to hand it back to the commissioners. There's quite a lot of work that was done overall in operations improvements, and we didn't talk so much about that, but perhaps that's part of your question. So I'll just leave it back to you. I'm aware of the time. So.
Great, thank you so much. What a full presentation, a lot of information that we've been talking about and following for a couple of years now. So I'm going to turn to my colleagues first for questions and comments. Mr. Wolf?
Yeah, thank you, Madam Chair. So, Luke, that page 31 there, if I had a report card like that, I'd think, wow, that's awesome, right? Do you think that, is this bad numbers, do you think, in your eyes, or no?
I think it's...
And how would it look if it was other counties? I mean, if we compared, are they...
And we looked at some of the neighboring counties. I don't know, Chris, do you have any data?
Yeah,
we don't have this packet, though, but we looked at other counties.
We have it.
There's very
there we go.
similar.
Okay.
There we go.
Yeah, so there's...
Oh, there we go.
I see it, okay. So
it highlights that not a lot of differentiation amongst the counties.
but you want to keep that, like a restaurant, you want to...
Totally.
You want to have a good number, right? So, good. Okay, thank you.
Commissioner Brennan?
LATG was brought up in a couple of the conversations, and I'm wondering if there's an update on LATG and LATG at the jail, and is it going to a different system, or what is being done on that to improve it?
I think the easy answer would be as part of the capital improvement plan that we submitted, a few years ago now. When the replacement comes, we would really want to look at the jail JMS, it's called, the jail management system, as specific and maybe not part of a bigger sweep, but what's the best management system for the jail folks that can track data, provide good reporting, and also eliminate some of the work, by making it very efficient. So that would be our goal when the replacement continues, that we'd really be able to delve into that stuff.
Is there a time frame on when that's going to be done, or?
So we're working towards the replacement of LATG for CAD and mobile sometime in 25. I believe the jail funding comes sometime in 26, moving into 27. So it's coming. It's in the 5-year plan.
Thank you. I have another question. There was a discussion about moving people out of the area by using Lyft and Uber. Do we have an understanding of how many people are staying in the area and where they're going? Is that something that we can track or not?
Generally, I mean, we work with the individual on what's their plan, and some people have a family member, a parent coming to pick them up, but we don't track where they're going back to or not. This is really reserved for the people that, and you think of mental health and addiction issues, right? There's some people that have nobody in their sphere to provide assistance to them. So those are the folks we're really, getting at to help, but we don't generally know where they're going or who's picking them up, as long as we know they got a ride coming, and they got some options.
Commissioner Eldrick.
I'm wondering, in the off years when you're not having an inspection, do you do a mock inspection, or is there a company that does a mock inspection, or can you do your own mock inspection?
Yeah, good question. So we are required to self-audit in those off years. And so Caleb and I will basically take everything that normally would be done when the inspector is on site, and him and I will review that to see how we do it. And we are required to report back to the DLC on how well or not we did with that.
Okay. Another question. It's a category of supervision of healthcare. You've got the nurses and the medical staff and then the doctors. Now, I guess I'd like to know, if the doctors are just there to do care of patients, they wouldn't necessarily be doing supervision of healthcare. I guess I'm wondering, what's the ongoing supervision of healthcare? Like, for example, auditing charts that the nurses write, or digging in a little bit of the operation of the healthcare. I guess I'm wondering if our medical director views that as his role or not. And so I guess I would like more on that, so that there is some supervision. Yeah, could you talk about that?
New role we discussed that's being opened right now, we just created. So it'll create a supervisor versus, previously we had a lead nurse, so she helped manage the caseload and stuff, but now it'll be a supervisor that will manage the staff, review charts, and also do all the, there's some cases that come through of people that need a lot of work, a lot of calls with St. Francis to other agencies and coordination of care. She'll be able to manage all that as well and not pull her away from going to see the inmates that are here today because of this new case. So this person will really be able to help manage the whole system for us and work with the medical director as well on getting feedback and kind of more observing it from above, not being in the weeds on every case like previously.
Thank you.
Commissioner Beer?
Good.
All right. I have a few questions, but I'll send my comments and questions. One, I think Commissioner Wolf's question or comment was really important. It's important for us to classify, because I think if people are just looking at this packet, it's hard. You look at page 31 and 32 and you think, well, how did we fare so well if we have all these violations? But I think what you were saying, Caleb, is that there's a bunch more. You just put the ones there that we had a compliance violation on. Is that correct?
Correct. Yeah, so for comparison, those are the ones we had violations,
right,
but not what the other counties
exactly.
had. Yep.
So that slide that just went on the screen that I'm not sure was in our packet, showing that in the metro area we're kind of...
It's page 24.
Oh, 24, yeah. There we go. Very similar. I could assume that there's enough, we're not out of whack and we're doing better than some of our neighbors. So I just think that's important to highlight, because if you just look at this, you might have a different conclusion. One thing, I think I'll just stick to the staffing, because we've talked about the staffing so much for so many years, and I'm just interested and intrigued. And Caleb, you talked a little bit about the additional kinds of recruiting and getting people from other states or other careers. Have we learned anything from? It's been like an intense year of that. Have we learned anything? Like there's some specific experiences or skills that maybe we never looked for before that are really important and help corrections officers not only just do a great job, but also stay a long time. Anything interesting or any learnings from that?
I'm sure, yes, absolutely. I think we are continuing to learn with each class that starts. We just had a class of 5 individuals start this morning. So that's exciting, but each time we go through this, I think we learn a little bit more about who does best in this type of work. And that's constantly evolving. I think the key takeaways for me have been looking at people who are looking at this as a second career. They've worked in an office, their whole life, typically in industries that aren't public service oriented, and they're getting to a stage in their life that they want to serve their community and have some a little more interesting job. We have a lot of people that start and say, I'm just tired of sitting at a desk, and I want to do something for the community. And we can provide both those things in spades, but there's a sacrifice that comes with that as far as working weekends, working on the holiday. Your job is not at a desk, so you're dealing with people all day long, which can be exhausting for some people. So trying to manage that and learn how to, I think where we do best is when we educate people who are starting on some of those challenges beforehand. So at least they feel, they still have to deal with the challenges, but they feel like they're walking into it armed with the information they need. So our training, we've had to adjust that enough to really focus on that idea of being realistic with people about what this job is.
Great, thank you. That's
I
interesting.
think on that too, we opt for, similar to the dispatch conversation, how we provide a sit-in, come sit and just see what it looks like. We provide tours as well, because there's some people that may walk in that door and within a week go, this is not for me, the feel, the look, whatever. Or some people have, I talked to a gentleman a couple months ago we hired, who his only experience in law enforcement or in a jail was when he was a kid. He did a tour of LA County Jail as like an explorer or whatever 20 years ago, and he's one of these second career guys and goes, I kind of was worried it would be this huge facility like that and just the feel. And he came into a tour and it's like, this is different. This is more fits me. So that has all worked. And then the other piece, we still see a lot of law enforcement students. Criminal justice background has been kind of our mainstay. And we struggle because there's so many law enforcement jobs now that those people don't stay very long, but it still works out. I think we've hired I know we've hired in the last 3 years 5 deputies that came from our jail ranks. That's the reason we're fully staffed right now in our deputies. We would have probably come up short with hiring without those people. And even Molly's new reentry person came from the jail years ago, went and did other work in the county and now is landing there. So even in that churn, there's a lot of good things. And our local PDs have hired many of our officers in the last few years, so there's that churn, but also a good establishment of kind of knowledge that people are taking to their next piece as well.
Thank you. That's important for us to remember, because I think we look at that turnover rate and really focus on it, but to know that some of that turnover is yielding really good things for our community. So thanks to all of you for the work. Thanks to the questioners who really delved into this, to everybody who's worked so hard on this jail study. This obviously is just foundational government work, providing the jail, like you've said, 24/7, 365-day operation that I think a lot of citizens forget about. But if we look at our budget and our duties, it's a very, very big part of what we do here. So thank you for taking that seriously. Thank you for not just, we do a good job at the people who go to jail stay in there as long as they're supposed to and all of that. But thank you for remembering that many of these people are our friends and neighbors and relatives and people who live here who are going to be out of jail. And if we can help them while they're there to get some things that they need so they don't go back, and so that they can get back to family and employment and good things, that serves us all really well. So thank you very much for that. Any concluding comments?
No, I just appreciate the work that people have done, and we'll like to come back in a year or two and tell you more.
I think we'll want that. So thank you very much.